on the news this evening from our health minister that we are now officially in a second COVID-19 wave. I'm joined now by Dr Lumkile Mondi, an economist and lecturer from the University of Witwatersrand. Lumkile, thanks so much for joining us. The minister said that additional measures are being considered in terms of what to do about this COVID second wave, but he wouldn't be drawn on whether another hard lockdown was off the table. What do you think, given the massive financial economic implications of a hard lockdown? Do you think that ship has sailed and we will never return to those stringent levels?
So firstly, let me just make a point. That is, what we see with the second wave is a reflection on the breaking down of our institutions in South Africa, all the way from the household to the churches, to the school, and to the institutions that are subject to the vendor commission today, where citizens don't believe authority and they're willing to take chances and take risks. So therefore, the fact that when the regulations were implemented, some ministers broke them and were just given a slap on their wrist, has encouraged them to take law into their own hands and believe that they will always be safe. So therefore, really, this second wave should come as a surprise, but a lockdown for South Africa is extremely unaffordable, given the impact it's going to have on households and the broader economy, which was on the way to recovery, as we saw early this week with the GDP figure that released by TTC.
Do you think, though, that some of the measures that we've seen imposed on Nelson Mandela Bay, given that now 4 provinces have been identified as the drivers of the second wave, and that's the Eastern Cape, the Western Cape, KwaZulu-Natal and Gauteng, do you think those provinces could perhaps expect some measures such as a longer curfew, a curfew earlier in the evening, rather a restriction on alcohol sales to a certain few days of the week, and perhaps a banning of any sort of public gatherings, that sort of thing?
That research might be possible. I think what I've encouraged the Parliament and the Minister were being held Parliament soon, but also through the NCCC, is to really rely on other institutions. We know that engagement with business, with the clergy and broad society around them playing a much bigger role in terms of spreading the message much deeper. And then thereafter, then introduce some restrictions. I think the restrictions that are coming from the NCCC without community involvement, they're likely to be defied, and as a result, it's not going to really slow down as we like to see the spread of the second wave happening. So I think the involvement really of institutions, despite what I was saying earlier, that they're weaker, but I think an attempt has to be done to try and reach out and really convince people of the importance of staying at home, of abiding to restriction, and really doing what is required so that we can slow down. But also, that's the last point. We also, at South Africa, the fact that we have not signed up and committed fully to accessing these new vaccines, it means basically that if we don't do the negotiations with communities and cooperation, we may find ourselves in a far worse position because Europe and America, both America and Canada, are now about to approve, if they haven't approved yet, in the case of the US, some of these vaccines. So they'll be able to curtail and open their economies. We cannot afford really a complete lockdown, nor the fact that we're behind in terms of vaccines. Can you afford another 9 months of a continuous spread of the disease?
So you mentioned the breakdown of our institutions and that citizens don't believe authorities, and you put that as the main reason why we haven't had full compliance across South Africa. You're talking now about community involvement. We know that the Minister has been in the Eastern Cape today, and he believes that sharing a lot of information is one way to also bring people on board, let everyone know where the hotspot areas are on a day-to-day basis, almost like a weather report that you wake up and you look at where are the infections bad. Do you think that we have the capacity to mobilize communities, you know, even from as little as street committees, WhatsApp street committees, to get people on board? Because that also requires a lot of organization and a lot of planning. Or is it literally going to be that there'll be some of us who comply and others who are just going to keep spreading the virus, and it's just going to get worse and worse until the vaccine comes along?
You must remember that, in many formal communities, or compliance does take place to an extent in terms of the restrictions, but the behavior may not be as good as they like to be. Many South Africans have been really doing business as usual in informal communities where they're fighting for survival. That, any opportunity of not going out means that you may not be able to get bread or any food on the table. So for them, any restriction or closure or lockdown is taking away bread on the table. So it's a very complex conversation. That is why any thoughts of a lockdown will have to be accompanied by a huge social support program where food parcels and other means of support are available to many South Africans who, in fact, these sort of lockdowns impact on their own livelihood, making them not complying with any form of restriction. So we have to think through and deeply about what form of restriction and those restrictions, what support is given to the poor, marginalized, and those that are living in very difficult conditions.
Absolutely. Thank you so much, Dr. Lumkile Mondi.